right, welcome everyone to the second talk in our Cortex Conversations Brain Health series. So in July, we explored the causes of Alzheimer's disease and modifiable risk factors, which can actually be found on YouTube. And today we're continuing this important conversation through a panel discussion, shifting our focus towards the role of care partners in dementia and viewing this through the lens of cultural diversity. So my name is Harleen, and I'm currently a graduate student in clinical psychology at Toronto Metropolitan University. And Dr. Rabin and I formed Cortex Conversations together as a way of connecting the community. So we both share a passion for science communication and believe that translating important scientific discoveries into accessible information is key to improving lives. Whether that's online or in person, our goal is to host free and open talks so we can have important conversations with our community. Now I'm going to introduce today's moderator, which is Dr. Jennifer Rabin. She's a registered clinical neuropsychologist, a scientist at Sunnybrook Research Institute, and an assistant professor in the Department of Medicine at the University of Toronto. After earning her PhD in clinical neuropsychology from York University, she completed her internship and a 3-year fellowship at Harvard Medical School. In 2019, she started the Cognitive Brain Health Lab at Sunnybrook Research Institute, where she continues to conduct research. And to introduce our amazing panelists today, we'll first start off with Navjot. She is a PhD candidate in public health at the University of Waterloo. Her research focuses on the experiences of South Asian Canadians living with dementia and their care partners, with a strong emphasis on advocating for culturally inclusive dementia care. Navjot's commitment to this field is deeply personal, as her grandmother is living with dementia and is being supported by her parents as her care partner. Next is Beverly, who has been with the Alzheimer's Society Peel for 6 years. In her current role as the Community Services Manager, Beverly and her team guide individuals through the challenges of living with or caring for someone with dementia. She also has a special interest in developing support groups and peer support programs, and Beverly holds a Bachelor of Social Work from the Toronto Metropolitan University. Next is Ripley, who has been with Alzheimer's Society Peel for 7 years, working in various departments, including client services and community services. She currently coordinates the First Link program, collaborating with healthcare professionals and community partners to support individuals living with dementia, their families, and caregivers. Danielle brings 26 years of experience in the field of gerontology, including roles at the Alzheimer's Society Peel as a counselor, First Link coordinator, and now as a public education coordinator. Danielle holds a degree in psychology from York University and a post-degree diploma in gerontology from Humber College. Her work has focused on raising awareness, providing education, offering referrals, and advocating for those affected by dementia. She is also personally invested in this cause, as she has a parent with vascular dementia, and both of her grandmothers had Alzheimer's disease. Our next panelist is Ron, who is a passionate advocate for dementia, caregiving, aging, and research. As a former caregiver to his father, who lived with Alzheimer's disease for 10 years, Ron brings a unique perspective to the conversation. He is the co-chair of AgeWell's Older Adult and Caregiver Advisory Committee and received their Honorary Fellows Award in 2020. Ron also advises, presents, and coaches numerous organizations across Canada, including Alzheimer and Dementia Societies, Healthcare Excellence Canada, and the Canadian Centre for Caregiving Excellence. And last but not least, we have Leela, who is a care partner to her 72-year-old sister who was diagnosed with Alzheimer's about 2 years ago. Leela's family is originally from Guyana, and her experiences as a caregiver provide valuable insight into the challenges faced by families living with dementia. And now I'll hand it over to Dr. Rabin to kick off our panel discussion.
All right. Thank you, Harleen, and a big thank you to our audience members for joining today for what promises to be an insightful and important conversation. We are here to discuss a topic that touches many lives, supporting and caring for individuals with dementia. And specifically, we'll explore how culture plays a vital role in shaping the care partner experience. As we all know, dementia affects millions of individuals and their families worldwide. However, the way we care for people with dementia is deeply influenced by cultural values, traditions, and beliefs. These differences can impact everything from the decision to seek care, to how care is provided, and even to how family members cope with the challenges of supporting loved ones with dementia. Today's webinar brings together care partners and experts who will share their insights and experiences. Through this conversation, we hope to convey an important message that no one is alone in this journey. So let's start with the first question for the panel. First, we'd like to talk about how you first recognized that something was not quite right with your loved one. So let's start with Navjot.
Thank you, Jennifer. I think for my family, we didn't really realize anything was wrong. So my grandparents, once they retired, they would do 6 months in Canada and they would do 6 months in India. So when I think it was the first time when they started coming back to Canada, we realized my grandmother used to be disoriented way more upon coming back. And at that time, we thought it was just jet lag, and we thought she's getting older, and with age, the jet lag is just going on longer. Like, she would wake up and not know what time of the day it is, or she would get confused with names. Again, it usually was chalked up to the jet lag, and I think it was that kind of made her symptoms more pronounced, but at that time we didn't know what it was. And honestly, if it hadn't been for an incident that led to us receiving a diagnosis, when we caught it at very early, like in the earlier stages, I don't think we would have caught on until it was much more later, like when the behavioral symptoms started coming in. It was just, like I said, an incident that led to us getting a diagnosis. Otherwise, it would have just been, oh, well, they're traveling back and forth, which I realized is very common in a lot of immigrant communities that once people retire, they tend to spend the colder months of Canada in their home countries. And this also kind of ties into what research has shown us, that in a lot of diverse communities, there is lack of awareness of what dementia is. There's no word for dementia in majority, at least in South Asian languages. There's no direct translation, right? Even if there is some understanding because of the cognitive symptoms, it's usually chalked up to, well, it's a mental health issue. And then we have a whole stigma attached to mental health. People don't want to talk about it, which just starts that cycle of, there's stigma, people don't want to talk about it, which leads to lack of awareness. The lack of awareness continues into the stigma. So yeah, for us, it was a chance discovery, if you want to say, put it that way, that we found out that my grandmother has Alzheimer's. If it wouldn't have been for that, I do not know how far along we would have gone before we would have realized what it was.
Thank you. Can you just talk a little bit more about the chance, like what you're referring to as kind of this chance experience that led to the diagnosis?
Yes, for sure. So it was during one of these incidents that she was very disoriented. She was not sure where she was, and she went outside at night and she slipped and fell, which led us going to the ER. And after the ER, we had a follow-up appointment with her doctor, and it was here that her doctor spoke Punjabi. So we had a same doctor from the same community, and it was because my grandmother was directly talking to her that she was able to pick those small, repetition of certain things, not having her certain, like, instances correct. And she kind of started that process of, this is not, this is something more than just jet lag and her, getting disoriented and confused. I feel if it wasn't for her doctor and if it was me or my mom being there translating, we would have ended up covering a lot of her, like, she would have told us something, we would have corrected it and translated it, and I don't think it would have been caught. So it was, think again, this highlights the importance of having that cultural piece in there, because the doctor was able to communicate to her directly without any medium in between, that we were able to get that diagnosis and she was able to pick up those instances. But again, we did not go in looking for a diagnosis. We did not see anything wrong per se. It was more so because she had a ER visit, which led to a follow-up with her family doctor, that we were able to get a diagnosis.
Amazing. Yeah. Thank you for sharing. All right, Leela, let's hear from you.
Thank you. It's good listening to you now, Judd, because in our community, people don't really talk about it. We were caught really off guard. And just up front, I'd like to say, even though we say care partner, I don't identify as care partner or a caregiver. This is my sister, and we live in the same home, have lived in this home for 40 years. So I'm just here for my sister and whatever she needs. So how we first became aware something was not quite right, this was during COVID. And she volunteered at a hospital as a spiritual care visitor, had volunteered at a food bank and a clothes bank. And during COVID, all of those stopped. So she ended up spending a lot of time by herself in her room doing whatever. And as adults, we don't look into what each other's doing. And we weren't getting many visitors either. And she's a very social person. So we said, well, it's all the environment, but we got together for meals and we would sit and watch shows and talk about things. But then I noticed that if I asked for something, she was an accountant. And one example was we were about to renew our contract for the furnace, maintenance for the furnace. And I asked her if she could look at different contracts and tell me which one would be the best one to go with. Normally, that's something she'd just give to me almost immediately. A day or two later, when I realized I didn't have the information because I would be making the arrangements, I asked her and she said her computer was not working and she couldn't pull it up. So I pulled up a few things on my phone and gave it to her, but she still didn't do it, which was unlike her. And I think that was, had we been thinking, that would have been a flag, but it wasn't. Looking back, there were many little instances of things. She's always helpful, and all of a sudden you ask for something and she's withdrawing or leaving the room, mid-sentence. Anyway, we became aware something really wasn't right when in a snowstorm, we lost our power. So I asked her to get some wood from the garage where we keep the logs as I cleared the plants from around the fireplace. And she came back and she had nothing in her hands. So I asked for them. She said she didn't see them. I thought maybe someone had moved it. I went in. They were exactly where they were supposed to be. I picked it up. We came in. I asked her to help me move the plants out a little bit farther, and she just left the room. Now, normally she'd be in there helping, asking what she could do. None of that came back. Other things were, it was summer, and I was looking for the milk she had bought. She had left it in the garage. Now, in the wintertime, if we bought a lot because we were going to make something, it's cold, we'd leave some in the garage. But this was summer. Another day I came home, it was hot outside. Instead of the air conditioning, she had turned on the heat. The house was hot. So as we noticed this, we started to talk and look at these things because they were not normal for her. My sister and I, an older sister, tried to talk to her to make an appointment to see her doctor. She said it wasn't easy to get her doctor. So I said, how about if I write an email with the things we've noticed and you send it to your doctor, which she agreed to do. The doctor then set up an in-person meeting. Both my sister and I offered to go with her, but she said she would go alone. What we didn't know is she had talked to her doctor before about forgetting things. And whatever that conversation was that day, the doctor asked who had brought her, and she had driven herself. So her doctor gave her a letter and said she shouldn't drive unless she gets an assessment. Well, she had already withdrawn into herself, and this was the ultimate shock. This just, like her world shrunk because she couldn't drive. She went to her doctor. She has a very thorough doctor, and I'll talk about how we got the diagnosis later, but this was where we actually realized. But looking back, she had told other people, but she's an honest person, so she said something, and honest and kind. And all of a sudden, not vibrant, withdrawn. It came as a surprise because in our community, people don't talk about dementia. We normally say it's part of aging for the elderly, but we thought she was so young. I still say she's so young, but now I find out about early onset, which is much younger. So I think we all need to be aware of the many faces. Thank you.
Thank you, Leela, for sharing your story. I think a lot of people will relate that hindsight is 2020. Looking back, you notice all of these things, but in the moment, your mind really isn't thinking towards dementia. So I think that's a really important point you bring up. All right, let's move over to Ron now.
Okay, thanks, Jenny. So for the audience here, it's actually good for them to kind of know the different stages where the first three of us are. So like Leela is quite new to this, like just less than 2 years, and Navjot, I would say a little bit longer, right, in the middle. For me, my dad was diagnosed back in 2007, passed away in 2018. So over 10 years. And time teaches you a lot, okay? Even time after, when you're not a caregiver, post-caregiving is what I call it. Even to this day, I still say, oh yeah, didn't realize that was, a sign, okay? If you've never gone through it before, there's no reason why you should know how it's supposed to look, right? If you're not looking for it, you will not know. Of course, we have the team here from the Alzheimer Society that has seen it. They've seen the same stories come. It's all different, but still they say, yes, we've seen it before. There's patterns. So that's the benefit of everyone who's coming on board today to listen and to hear these stories and to learn is that it's not new. Okay, this is not new, but if you've never gone through it before, it will be new for you. Okay, so for us, 2007, okay, my father, Filipino family, okay, there's my dad, my mom, and then there's me. So the only child, I was the favorite in the family. I always remind people that. Okay, also not the favorite whenever, so some people are laughing, they'll get it. But during that time, even before 2007, my dad was the most quietest gentleman, grew up Catholic. Okay, he was an altar boy, very soft-spoken. And we didn't realize as time went on, let's say 2005 to 2007, he started to get aggressively verbal with all of us. Okay, he would start accusing. Okay, so accusing about where's my money? Okay, they didn't pay me back my money when I went to the coffee shop, right? Had no idea what that was. And then eventually he would start telling my mom is that she stole money from him. And then my mom would ask, hey, can you come over to the house? And can you talk to him? Because he's getting really upset with me. And again, he was never physical, but he was very verbal. Did not realize what this was. I had no idea what dementia was at that time. The challenge with our doctor, with his doctor, is that the doctor would not go visit him. That's just the doctor he had. He says, no, I'm not going to go to his house. You got to bring him over here. Of course, at that point, he says, nothing's wrong with me. I don't even want to go see the doctor. We had to it was an emergency room visit, similar to Navjot. It was like, we had to plan it out, okay? Because it was with my friend who's a police officer, my cousin who was a paramedic. They started telling me, we have to form your dad. So people don't know that here in Toronto, Ontario. I don't know what it's called elsewhere, but a Form 2. Okay, pretty much. We had to bring him in, but we couldn't just bring him in. We needed him to kind of threaten my mom. And that way I could call 911 and say, hey, everyone, let's mobilize now. Please come over. Police came. Can you take him to the hospital? That's when we realized about a week later that the doctor said, hey, by the way, I think your dad has dementia. And by the way, his diabetes is so high. So that's how we realized it, but it was him threatening, verbalizing, and I didn't figure that out until months, even years later, that was. So that's how we started.
Yeah, thanks, Ron. I think it's just so interesting to see the different pathways we see with Leela's sister becoming more withdrawn, and with your dad, the opposite, becoming more aggressive. So I think it just highlights that it can present in very different ways across different individuals. So I'd like to open it up to those from the Alzheimer's Society here who might be able to chime in. And I think, Ripley, we'll start with you. I also just want to make a point to the audience that if you have any questions, feel free to put them in the chat and we'll try our best to answer them at the end. All right, on to you, Ripley.
Okay, so my lived experience goes way back further than Ron's. Mine goes back over 20 years. My mom was living with me at the time on the excuse that she was there to help me with my young children. And I went to work in the mornings, things were fine. I came home in the evenings, things were fine. Never suspected there was anything. Then it was a holiday, and we had gone to visit her brother. And I'm spending all day, several days with her. So now I'm spending a lot more time. And she didn't know her brother. And she kept asking, who is this man? Who is this man? Every 5 minutes, she was repeating, "Who is this man?" And I kept telling her, "This is your brother." And that is when I found out that she had Alzheimer's. Shortly after that, she left the house on the excuse that she was going to the store to get snacks for the kids. And then she got confused and couldn't find her way home. So a friend saw her heading in the wrong direction and turned her around and brought her home. And this led me to realize that I had been missing a lot of flags before. Flags were her hygiene had started to deteriorate. Um, she wasn't taking good care of her hygiene. Her cooking skills had gone south. She had put soap in the food instead of salt. Her personality had started to change. She was more less, she was more aggressive with my little niece than she was with the boys. She loved the boys, but she just took a dislike to my niece. So looking back in hindsight, we could see the symptoms coming up, but it was only after spending so much time with her, because in the morning she was fine, and coming home in the evening she was fine. But it was during the daytime that the symptoms came out.
Great, thank you. Anyone else from the Alzheimer's Society want to chime in? Beverly or Danielle? And then maybe we'll move to the next question. Danielle.
Yeah, so I have a parent living with dementia. It's my dad. He was diagnosed at the age of 62. So he was young, considered the young age onset. So just to put that out there, it is a myth that you have to be elderly to develop dementia. Of course, I did work in the field prior, so I did pick up on it pretty quickly, but my experience working with so many families over the years is that often the symptoms are present for 2+ years before people actually seek, some kind of assessment or, speak to a doctor or something like that about what is this that is going on. For my dad, our early symptoms, because his diagnosis was mixed dementia, vascular dementia, and frontal temporal lobe dementia, memory was not anything we noticed with my dad. In fact, his memory became impaired about a year ago, 13 years in. So what we saw was very poor financial decisions, getting scammed and being defrauded and not being able to recognize that he was being scammed, although it was like very obvious to anybody else looking in. And his social norms and the way that he would normally interact with others completely changed. And so the day I knew that we needed to go to have something looked into was the day that he visited his friend in hospice. His friend was dying of cancer and was married. The wife was there. And my dad said to her, when he passes away, which should be soon, do you want to date me? And the family called horrified, and made a call to me to say this had happened, and I'd already been adding up little things like, and so for me that was the moment I said, and that is not in any way something my dad would have said or done ever in the past, and so that was for us. So it was personality changes and also very quick frustration, very, very changes in his ability to control his moods, that his moods were dysregulated. So for us, those were the warning signs.
Thank you. So again, I think really just highlighting the very different experiences across the panel, and note that we did not find these people to highlight these differences. It's just naturally came out because this is always the case, that everybody has a slightly different experience. All right, so moving on to the next question. I'd like to ask the panel if you can tell us about how you ultimately received the diagnosis, as well as any challenges you experienced navigating the healthcare system to ultimately get the diagnosis. All right, so let's start with Ron.
So as mentioned, it was at the hospital. So my dad was there for 2 weeks. Um, and I tell this story in some of my presentations, but I don't think any of you know this story here. I haven't shared it with this group here. Is that somewhere along the way, I think it's like a week into it, I was visiting my dad there at the hospital, and then the doctor kind of just turns to me and says, "Oh, by the way, get ready. I give your dad 2 years." Right? That's how he says it. And I kind of look and I said, "I know nothing here." I said, "2 years of what?" And he said, "Oh, your dad's not that great, and just the way he is right now, um, you know, you have to prepare for his end of life." And I didn't know that a lot of people still get upset with that because that's not really something you can diagnose. It actually was a gift for me. I approached these things differently, and I said, "Okay, doc, if you say 2 years, because I knew I don't know what I don't know," I said, "I'm going to work hard to get him to 3 to 5 years." We got to 10 years. Okay, so I'm looking for that doctor to say, "Well, thank you for telling me that because you pushed me to kind of pay more attention," even though he was way off on that, let's say. So that's how we got that diagnosis. We had to go here in Toronto, Scarborough specifically is where I'm from, a lot of visits with the psychiatrists to work on the medicine. Okay, so that was the biggest issue we were doing, and took us about 2 to 3 months to work that medication piece. And that was the part where we were a little bit scared because we're going to bring dad home, and is it still going to be the same? Is he still going to yell at mom? We don't have. I have no idea. Okay, so it worked out, and then he had a pretty decent life afterwards once we got things in control. So that's how it worked out for us. But a lot of work on my end, because this is a conversation on culture, diversity, and that piece. Definitely family and friends from the Southeast Asian Filipino community. Love them, but they just didn't know how to deal with this, right? So pretty much they kind of quietly disappeared over time. Still got dad to his mall walks with the group, but then you could tell that they were just kind of like dragging him along. And then that kind of stopped over time. So that was just more navigating the social aspect was our challenge. But yeah, again, for a lot of people here, it's how you approach it, and can you get that, be proactive in seeking out information or how you handle responses, so yeah.
Great. Thank you for sharing. What about you, Leela?
Well, ours was a little bit more direct in that my sister went to her doctor. Her doctor realized, based on what she had told her before and whatever that conversation was, which was the letter, "You can't drive anymore unless you get this assessment." But a very caring and thorough doctor. She ran blood tests. My sister's thyroid, TSH, which is a thyroid hormone, came back at 29. The high normal is 4. So we weren't sure what that was about either and how that may be contributing to what was going on. She referred my sister to Baycrest here in Toronto. And, that team is just amazing. I have tremendous respect for that hospital. And so we got to see a neurologist within 4 or 5 months. And with a thorough cognitive assessment, they had seen her before and she was fine because she had recognized way back without telling us that she's an accountant. So maybe her numbers weren't working too well for her. And so there was a huge decline, but he didn't call it at that time. He ordered a blood flow for the brain, a scan to see what that was about. But he did right away talk about the depression and that we needed to start treating that. So he asked her if that was okay, because as most people know, waiting for a psychiatrist is a long wait. So he started with that. 2 months or so later, we had the scan and the results, and it was at that point that he said it looked like it was Alzheimer's, because he can't definitively say things unless you get much more invasive. But he wanted to continue to treat her for the depression as her family physician was dealing with the thyroid issue. They had given us a date of August So this was a December, August that she'd see the psychiatrist. But I'd ask that if they get to any cancellations, we'd go with no notice. We ended up going in January, so it wasn't long after. One of the best people I've met in my life. Her caring not just for my sister, but her concern for me. Because in the early days, I cried a lot. My sister and I grew up together. We're very few years separating us. Our life experiences are the same, pretty much. And here, out of the blue, her life had changed drastically, and so had mine. Those 2 years have been the hardest I've ever had to go through. Anyway, with this team, we knew we were in good hands. So they continued to deal with the depression, and then behavior started, as Ron mentioned, and they worked on those medications. They were very conservative, starting low, slowly moving up. And then at one point, the neurologist thought they should try some medicines for Alzheimer's. I went to with my sister to almost all her medical appointments. If there were diagnostics, someone else might take her, but any medical appointment, except maybe one or two, I took her to. And I would always ask, what are the benefits? What are the risks? And having to weigh that because I'm one of her POAs. So how do I make a decision for her that I think would be in the best interest for her? And so those medications, the first Alzheimer's one didn't work. She got aggressive, and that's not her personality at all. So I called in and they said, stop it. Waited a while, tried something else. That seemed to be okay. The neurologist wanted to continue it, and we're seeing him again in January. But we see the psychiatrist on a fairly regular basis. And if she's having a bad day or I can't get her to go or she's fussing about something, even on short notice, they'll do a Zoom call with us. And the psychiatrist will talk with her, get a sense, and then ask her if it's okay to talk to me about the medication. And that's how we've worked through it. So, we're talking Alzheimer's, but there are also medical things going on. So one of the medication, the psychiatrist asked that her doctor check her ECG because it could have affected that. It was abnormal, and that got us into a whole range of tests and other procedures, including a scan at Sunnybrook, because she can't really explain. So got to rule out everything. That we got a really nice cardiologist too, and that worked itself out. Then she started to complain about pain in the stomach. Sometimes it's a chest, sometimes. So we saw an internal medicine. And in all of that, everything is now being managed. I feel very fortunate that we're at Baycrest. They're just amazing.
Thanks, Leela. Yeah, I think it just speaks to how important and valuable it is to have a good support system, not only within the immediate family, but also within the healthcare professional realm as well. So I'd like to hear from Navjot, and since we already heard about how your grandmother received her diagnosis, I was wondering if you could touch on about how your cultural background has influenced, navigating the healthcare system.
Yeah, no, for sure. Thank you, Jennifer. So, like I said, for myself and my family, the diagnosis was relatively straightforward just because of the connection we had with the family doctor. And after that, we were kind of sent home with nothing, if that's the right way to put it. And I'll get back to that as we move further along. But for now, I just want to take a step back and kind of talk about the cultural nuances that goes around when navigating healthcare system as a person of color. So not just from my personal experience, but also as my role as a researcher, just pulling from some of the experiences that are out there in research. One of the issues is just the language barrier. A lot of diverse communities, English is not their first language, or they do not have a strong spoken command of the language. So they often need translators coming in with them. So, for example, in my instance, if it was my grandmother, it would be me going sometimes when I have the time, or if my mom has the time, she would take the. So it's not just one person consistently showing up to all the appointments and able to like, keep track. So it's like me telling stuff to my mom telling stuff that I told her and what she saw in the appointment to my sister. So there's a lot of people involved, and it just creates a lot of those cracks where information can slip and you're not really able to stay on top of that. So that's one issue. The other one is just around the family dynamic. So a lot of diverse communities, there's this not really individualistic, but more so like a communal thing where the entire family pretty much shows up for the appointment. So, if there is, the children are often the spokesperson for their family member, especially if it's their older parent. And in those instances, there have been research has shown that they want to shield their mom or dad from the diagnosis because they don't feel there's any benefit of letting them know. And this does cause a lot of ethical challenges, especially when the physicians have to disclose it, right? But if they're relying on the family member to translate it, how will they know how much the patient actually knows, right, about their diagnosis? So those are some of the other challenges. And then also, like as Danielle mentioned, there's a time between when the first symptoms first approach to when they get the diagnosis. This gets even more stretched out in diverse communities because most of them live in multi-generational homes, right? So the small things which you're able to pick up, like you're not able to know where the tea bags are, not able, like, how Leela mentioned, messing up the cooking or not knowing how to cook certain things. These often get covered up because when the daughter-in-law comes in, she's the one who takes over the kitchen. So now the elderly mother-in-law is not doing the tasks from where we would have been able to catch those certain things, right? Or if it's the male of especially from a South Asian community, they don't do such things as, cooking or folding laundry. So it's even more difficult to, get that baseline for their activities of daily living to see, like, is there something that's not normal for this person? Could this be dementia? So these are some of the cultural pieces, which while navigating does become, adds that another layer of getting that diagnosis. And I think even taking a step back, in order to get a diagnosis, you need to realize that something is wrong. So even the first step of just recognizing that that's something wrong, it's itself a very significant barrier in diverse communities because if you don't know there's something wrong, you're not going to go and seek out, say, a diagnosis or figure out that something is wrong.
Such great points. Thank you. Ripley, is there anything you wanted to add before we move on to the next question? Oh, I think you're muted.
Sorry. In my case, this happened out of Canada. So we didn't have to navigate the system in Canada, but the diagnosis came from her doctor, the family doctor. And in our culture, we keep it in home. We keep it private. There's stigma attached to it. So we take care of family at home.
Okay, great.
I was just going to say, in my case, I think this is a common experience as well. Although we saw the symptoms and we knew something was wrong as a family, my dad wouldn't go to the doctor for assessment. So what I did was I started to write down, like record dates, times, things we were seeing, things that were very out of character. And we sent it to his family doctor so that the next time he went in for something unrelated, his family doctor would at least have a clue that we were worried, concerned, and started to kind of ask him things and then realized, oh yeah, okay, I see what they're talking about. And then made a referral to Baycrest as well. So we ended up at Baycrest. But for us, that's how we had to get him into the doctor. So that was our big difficulty at the beginning to get a diagnosis. And it was also that because he was young, it was sort of like, could it be something else? There was more questions around whether this really was dementia right at the beginning, right?
Important point. Thank you. So I'd like to hear from the panel about how you are managing at home or managed at home. And maybe we can also touch on stigma, because I think that's a theme that's come up kind of throughout all of the panelists. So let's start with you, Navjot.
Yes. So like I said, like for us, I think once my grandmother was diagnosed, we kind of went home with nothing. And surprisingly, we carried on for a while. Like I said, we live in a multi-generational home. So we were all there, me and my siblings at that time. I have now moved out, but my parents were there. So, and since we caught it relatively early on, like, she would forget her name. It came to a point where, she would call me by my aunt's name. I would just respond because I knew she was referring to me, right? So we kind of just moved around things slowly. Like, she was no longer able to make her tea, because that was her thing where she would get up in the morning, make a cup of tea for herself, and sit down and listen to morning prayers and stuff on the TV. Slowly, those things started slipping away, and it's like, my mom would be like, okay, I'm making tea for everybody. I'm gonna make a cup for her. So my mom started picking up that slack, and it went on for a while until the behavioral symptoms came in. And that's where it was like, I would get panicked phone calls that, oh, well, your grandma is talking to the mirror today. What do I do? Or she's throwing stuff at the TV because she thinks the person on the TV is staring at her. And I was, I did not know, like, over the past I would say 2-ish years, things have improved in terms of resources that I can now share with my parents. There is the Forward with Dementia website through the Research Institute for Aging. There are resources from in this community, and the Region of Peel Alzheimer's Study has these toolkits. So there's so much more that I can share with them now. But initially, I couldn't do much when it came to providing them information. Like, I would try to explain it to them, but I guess me being their child, they never really took me seriously. And since they were the main care partners, it kind of felt like, well, you're coming in telling us to do all this. You try managing it, right? So I did not feel right, kind of, like one of the things when someone is living with dementia is we tell them, live in their reality. But my mom would argue with my grandmother, and I'd be like, Mom, don't do that. And at that moment, I didn't understand that my mom was getting burnt out as well. She was the one, like, she's the sandwich generation, right? My siblings are younger, so she was taking care of my siblings. She was working full time, and then she was on top of that taking care of my grandmom. And this is another cultural piece that comes in where often daughter-in-laws or daughters are the one who do most of the heavy lifting when it comes to caregiving, at least in South Asian communities, speaking from experience. So yeah, so those were some of the pieces in terms of not having the resources for my grandmother and kind of having that difficulty of managing at home.
Yeah, such great information. I just wanted to let the attendees know that we will send lots of resources out in an email after the talk. So no need to jot anything down. All
Sorry,
right, let's go to, oh, sorry, yes. No.
sorry, kind of lost my train of thought, but I wanted to bring in like the stigma piece, which seen within my own family on how much they shared about what my grandmother's condition was, as well as in research. This is there's this thing about, you want, like Ripley said, nobody outside your family knows, right? You keep it within your family. And this same principle kind of applies to there's one issue that there are not resources available out there that are linguistically and culturally specific. But the other side to the coin is people don't want to use the resources because then it's like, oh, what will people say that we can't even take care of our own parent, right? So that's the thing where they feel like they can do it all on their own. But it's very important to know that it takes a village. Taking care of someone, being a care partner to a person living with dementia is not a one-person job. You cannot be a superman or a superwoman and do it all by yourself. And I feel that's the message that really needs to saturate, especially communities within where the filial piety is very strong, to understand that asking for help is not you disrespecting your parents. It's you trying to get better support for them and ultimately for yourself, right? Because eventually, if you carry on like this, the care partner is going to burn out.
Yeah, amazing point. I once heard the analogy like on a plane when the oxygen levels are going down. Maybe we talked about it in this at one of our meetings. You put on your own mask before you help someone else, and I think it really just speaks to your point. So thanks. And Ron or Leela, do you want to kind of speak to your experience of the stigma?
Okay, Ron's pointing to me, so I'll go. The stigma is pretty much the same. And as Ron said earlier, slowly, friends kind of fall off. Family, I think mostly because they don't know what to do. I'm talking extended family here. And even within the family, we're not really talking about the diagnosis. And one of the reasons when you asked, Jenny, and I said I would participate, is if people talked more and we were open, this would not be such a shock, and we would not struggle individually or as a community as much as we're struggling. Because, as I went looking, I see resource. I understand things in a way that I didn't before. So yes, the stigma is there. We've been lucky. We don't have the language issue. We're from Guyana. It's a British colony. Both my sister and I were educated here. I kind of know the healthcare system, and if I had to navigate it, I'd probably do better than most. But regardless of how much you know, we all run into issues in navigating and trying to get the care that our loved ones want. Did you also want me, Jenny, to talk about how we're managing at home? Okay, so we've gone through, as I was preparing for this, I wrote it down. It started with the depression. Then there was the paranoia about being blamed for things, or not necessarily telling you yourself, but go tell somebody else, they're doing this, they're doing whatever. Her psychiatrist had recommended that she go to a day program. And I really struggled with that because back to we take care of our own, but also don't we know best how to take care of her and engage her? But her neurologist has said to us, look at diet. He had suggested Mediterranean diet, movement, exercise, and being engaged and stimulated. So we couldn't give her the level of stimulation she needed at home because anything she didn't like, she'd go up to her room and lie down. And that would be the end of that. So just getting her to that day program took a lot, but we did, and that's been a really good thing. She's had behavioral issues from the medication. That stopped when the medication was stopped. But then as the brain changed, other behavioral issues came in. And we were fortunate to get Baycrest's behavioral outreach team come out to our home and observe and guide us. And then Baycrest we're wrapping up next week, a caregiver support group that we were put in. And it's with other people who've had families that the behavioral support team had to come and help. We're doing much better. I've learned a lot. I've reached out. And one of the reasons I know Jenny is because my sister and I having such similar lived experiences, I'm also concerned, could that be in my future? So I'm looking out for things for her, but I'm also trying to take care of me. And what do I need to do? And so rather than try to do everything, the day program is a big help. I have other siblings, varying levels of engagement for different reasons. I've got 3 nieces, God bless them, they've stepped up. And she's very good with them because they're lighthearted and they'll do things. And when she's not at a day program, because I wanted to go back to my spiritual classes, at one point I couldn't think about anything myself. Forget about that mask business. I don't need anything. She's the one who needs it. And then realizing that I too needed help. And so we've got a lovely young lady. We pay her, it's private, for a companion to come and do things with her. They play games, she colors. I got one of the kids' basketball thing. So they throw the basketball. We've moved it into the garage now that it's cold, but it's too cold. They can't do that anymore. So now they're dancing. So it's whatever kind of gets her going. And there's a change. There are moments now. The depression was very, very sad, very withdrawn. We're seeing shades of her, but not much. So we are managing well. We've learned a lot. Everything I learn or someone tells me, I try and I put it into practice. She's relatively calm now, though last night we had a little bit of the hallucination. And whatever comes, I pray that the love will see us through.
Yeah, amazing points. And again, just speaking to the fact that no one can do this alone, right?
Yeah. One thing I didn't mention that I'd like to point out to the cultural pieces. we believe in God, hence my prayer. But my sister remembers prayers. She writes her mantras still. Every now and then she doesn't get the right word. And we chant simple chants that she knows. And that is very grounding for her.
I think it's really important to find those experiences, right, that can ground you. So I'm just mindful of the time, but I will open this question up to the rest of the panel to see if there's anything anyone wants to add. Okay, Ron.
So I'll be quick on this one here. So the culture piece, I want to just throw it out to everybody here because we're talking about stigma, culture. Many times we put too much pressure on ourselves to try and get it right. Okay. And I want to kind of just throw it out based on my experience. It's not about trying to be right. There is not one right path for everybody. And if you hear our stories for those that are watching, just because someone goes in this path and says this is what worked for us doesn't mean that that has to be the path you have to do. And I'm seeing the Alzheimer's team here. I wouldn't mind hearing Beverly's thoughts on this right after this as well. But that right path, just be careful of right and wrong. Okay. And this is very quickly, it happened to be Baycrest. We keep bringing up Baycrest. And this is the culture piece. Okay. There's a question here by Natasha about retirement homes. I told this story to someone there, and he had his mom in long-term care. And because I used technologies and solutions and I kept my dad at home all this time, he said, how did you not get your dad in long-term care sooner? Okay. And I say this all the time. All my Western Caucasian friends in the year 5 mark and the 10 years says, why isn't your dad in long-term care yet? And I had to keep saying, I'm not even thinking about that. I don't even know what to do with that there. No, it's about he's still fine at home. Nothing right or wrong about that. So it's not like they're right or I'm right or whatever. So I just want people to be aware of that. But that's where I kind of told that person, because that person said, I feel so guilty that I put mom in long-term care. I said, another talk for another day, Jenny, when we do this is guilt. Okay, that's another conversation, how cultures accept guilt or deal with guilt. I'm at this stage now, guilt has nothing to do with caregiving. So that's another conversation. You're doing your best. It's not about right or wrong. So that's just a value system of how we approach things. And I just wanted people to kind of know that. Be careful of trying to make this about right or wrong and that this is the way it's supposed to go. It's what's best for your family to move forward with the situation that you're in and with the resources and the people and all that stuff. Okay. It's better to go to the Alzheimer's societies and get their voices as well. That's what I'll always suggest, at least. Like Beverly's possibly.
Such great points. I think we're going to, was it Ripley next? Or Beverly? Sorry, I've lost track. And then we're going to go to Navjot.
No worries. Yeah, I can definitely speak to that, Ron. Thanks so much. I just loved what you said about everyone's journey being different. And I know, Danielle, you've said this at your educations, and we say it at our, I say it to most of my clients. If you've met one person with dementia, you've met one person with dementia. Everyone's circumstances and symptoms are so specific to who you are. Even on this panel, everyone's warning signs were a little bit different of what they saw in their loved one. And that extends also to the care partner. So like you said, Ron, some people, it's a really early long-term care transition. Some people, they keep their loved one at home until they pass away. It's really that care partner is going to have different needs, different expectations, whether they're cultural or just personal. So there really is no one path you're going to have to go on to be the proper caregiver. It's really just going to depend on what your goals are and your loved one's goals are.
Great. Okay, so let's go to Navjot.
Yep, I just wanted to speak to the cultural aspect of like long-term care homes and retirement homes. So even like for my family, we're at that point where it's difficult now to manage my grandmother's care at home. Somebody needs to be home 24/7 to make sure that she's safe and sound. Her bedroom is upstairs. We don't have any bedrooms on the main level, so the fear of her coming down the stairs. But when looking, so the issue for us comes into we're unable to find a home that would be suitable from a cultural aspect, right? Would she able to get the food? She still dresses in traditional salwar kameez. Would anybody be able to help with her? Because we've had issues with PSWs who are not able to dress her in her cultural clothing. Would people be able to speak to her in her language? Like, would the PSWs be able to support her, get to know what her needs are? And I think this is one side where the and I'm not saying to all, there are care homes which are tailored for different communities, but in general, mainstream homes are not able to support people from diverse communities because of the said reasons. But I think the other side is, again, we have talked about this a lot, is the filial piety piece, the piece about keeping our parents at home. And like Ron said, this is not what we do, right? We don't send our parents. And I think there is that shift with the new generation, the second, third generation, where they want to, because they realize that that's where they're going to get the best care if they're able to get those cultural pieces in place. But the stigma with this is so prevalent in our community, where I've known people who have moved their parents, and they're the things they hear from their relatives, from their friends, that, oh, they raised you their whole life and now you've thrown them away, you've put them away, you've shipped them off. So that, I think there's that stigma, that fear of being shunned by your community, which again stops people from even considering this option. And there are instances where I've talked to care partners where they have, and I've talked to healthcare providers where they have initially said, oh, well, this is not what we do. But 10 years later, they go back. They're like, please, please get us into some place where our mom or dad can be. But by that time, it's too late, and people don't. And another thing is they don't know what the process is, right? You need to be on a wait list. You need to, so they're not even aware of those steps. So it's, yeah, so there are two sides to it, right? The stigma side, and then the home's not being a good fit. Yeah.
Thanks for sharing that piece. So mindful of time, and I hope it's okay if we go a little bit over, because I'd like to end by everyone on the panel sharing one piece of advice that they'd like to give to the audience. So let's start with you, Danielle.
Okay, so I love what Ron and Beverly were saying, because there is no one right way here. One thing that I have always said to family caregivers, I was a counselor with the Alzheimer Society for 9 years, and one of the things that I always said to families was, if you go down, if you don't take care of your wellness, then you're going to have to take care of your illness, because you will get sick as a care partner if you are so burnt out, right? And then what do you have left to give if you are completely down and out, right? So when you mentioned that whole the airplane analogy and the oxygen masks, absolutely. And so when people would say, well, I can't place because we just don't do that, and I do hear that from many care partners over the years, from all different cultural backgrounds. And then it's a discussion about, well, who's going to step in, or what's going to happen if you go down? Like, what happens, right? And then they're like, well, that would be horrible. So we start to kind of have to like relook at this from a different lens. And so maybe that's something we can do with care partners, from any culture, really, doesn't matter the background.
Amazing. Okay, what about you, Ripley?
Yes, one piece of advice I would give is to be informed. The more you're informed about the disease and the resources that are available in the community, the better it is for you. The Alzheimer's Society is there to help. There is no requirement for you to have an official diagnosis of the disease. You merely have to be exhibiting symptoms that are consistent with Alzheimer's or dementia, and then you can take advantage of their services. So get to know your local Alzheimer's Society. The education programs are free. There are lots of programs in terms of dementia education and support groups that will help you. And the earlier you start, the better it is for you and your loved ones.
I love that. And we will be sharing information. Look out for an email from us. All right, Leela, on to you.
So mine is almost in line with what Danielle said. Take good care of yourself, physically and emotionally. I found dealing with my emotions takes a lot of energy as my sister's brain changes and different things. This is not a sprint, it's a marathon. Know that you're doing your best. Protect your energy by not feeling guilty or taking on blame or criticism from others. I came to this realization of just taking care of myself after I got sick because I was trying to do everything. But I think it was my emotions that really got me. And I benefited from a caregiver support group. There are many. Ripley said the Alzheimer's has. I'm through Baycrest, so we have that one. And make time for yourself. This is not all about your loved one. And find joy in the little things.
Very nice. Okay, Beverly, and then Ron, and then Avjot, and then I'm going to pass it back to Harleen.
Awesome. Thank you. I think already such good advice already said by the previous panelists. I think the one piece of advice I could give, because I've noticed a lot what happens is people wait a really long time before reaching out for support. We see that a lot. And I think sometimes the reason is it's so overwhelming. People don't know where to start. Often you're given that diagnosis and you're kind of sent out of the doctor's office, maybe with a referral to somewhere else, maybe not. Maybe none of your questions were even answered. So I always say start with one thing that you want to get done, one goal, whether it's I have one question I'm going to ask my Alzheimer's Society representative. I'm going to watch one video on dementia. I'm going to attend that one support group, and I'm just going to listen the first time. I think then it becomes more manageable and you can start to build your path. And then next thing you know, I find a lot of caregivers who start that way. The next thing they know, they're connected to all these wonderful resources and supports. But it becomes a lot less daunting, and it's also a form of burnout itself when you're navigating that system. So I think starting small and starting with one thing can really get you on a good path.
Okay.
Yeah, love it. Ron,
Yeah. So Beverly, I love that. It's those little wins you try and get. Okay, the tiny little win here, little win there, and for people, it's just taking those tiny little steps. So the one I'm going to give is a unique one here, but I'm going to say be careful of the words you use. So people can agree with me on this or not, but you could try it out. I always tell people try it out, and many times they come back and say that actually worked for me. So if you can take the words right and wrong and good and bad out of your vocabulary and replace them with what's best at this moment of time, okay, that makes it a less stressful, okay, for every situation. And that's where guilt kind of is taken away, because if you keep saying, oh, that wasn't right or that was wrong, guilt sneaks up. So I just want to throw that as an example. It's just pay attention to your words, find powerful words that you can kind of benefit from. And the last piece of advice is go talk to other caregivers that have gone through it. You got the Alzheimer's Society, yes. You just happen to have people from the Alzheimer's Society here, like with Ripley and Danielle. I'm not sure Beverly, but has personal experience, right? But sometimes when you hear that someone has gone through this, like Leela, you're giving advice that someone who's brand new would say, oh, you've just given me those little wins, those little gold pieces that Beverly said that I'm dealing with this. You just gave me advice. You didn't even tell me that you realized you gave me advice. You just told me your story and I got some lesson from that. So go talk to other family care partners, caregivers that are going through this as well. So that's my piece of advice.
Jet.
Yes, I think for me, I'm just going to pass on something a care partner once told me is, you know your person, your friend, your relative, your family member the best. If there's anything you feel is not normal for them, don't brush it off as aging or them having an off day. Talk to your doctor about it, bring it up to them, speak up. And I think the same applies to the broader aspect of speak up as a care partner, as a person that share your experiences, especially in communities where stigma is so prevalent. If you don't have to go on to like a big podium or like, a big webinar. Talk amongst your friends, your circle. Don't say, oh, well, my mother, it's okay. There's nothing wrong. Tell them that this is the condition she has, and this is part of a disease progression, like any other disease we talk about. Because I think not until we don't speak up, there's going to be missing representation, and that notion that I've heard from my parents as well, that this is a Western disease. It doesn't happen to us. It's going to continue because the lack of representation is going to be there. People are not going to talk. But if we talk about it, we'll see people from all walks of life who are talking about it. And then it's going to be normalized. Well, oh, there's someone who looks like me and they're going through the same thing. Maybe it is normal. It is something that I should not be ashamed of. So I guess my message is to speak up, whether it's about talking about the symptoms to your family friend, your family doctor, or about just sharing your experiences.
such a great way to end. Thank you. Thank you to all the panelists. I'm now going to pass it on to Harleen, who's going to moderate the question period. So please feel free to put questions in the chat. And we will also try to answer the questions that you sent in over the last week or two. So on to you, Harleen.
Yeah, thanks, Jenny. Well, thank you to our panelists for really sharing your stories. And I'm sure everyone took away maybe hopefully just one little thing from our conversation today. And so just addressing some of the questions that are in the chat. So one question was someone saying, thank you for touching on language issues. It's very challenging to translate the nuances of some medical terms. For instance, describing different types of pain like tingling versus dull, if English is not their first language. So what are some steps that providers can take to mitigate this bias? Let's see, who can maybe speak to this? Danielle. Yeah, maybe.
Well, I was going to say there are, I loved that Navjot was talking about sometimes if you use a family translator, with the best intentions, they may not translate exactly what is being said, right? And that may be for a lot of reasons. There might not be certain words, like in Arabic, the word dementia doesn't exist, right? In lots of cultures, so some of the terminology that the doctor might be using or the healthcare practitioner might be using, there might not be a translatable word. So that could be one of the issues. But two, oftentimes it may be to protect. And so therefore, you're not sure what message is getting across. So using a service, if it's affordable, where the organization can actually use a translation service so that it's exactly what's being said, because they're not emotionally involved, right? Their job is just to straight translate. So I think that's one of the ways to mitigate, but it's not always like, oh, you can have a translator at every appointment. That's the difficulty.
Yeah, that was a great point. Just even speaking to the fact that there's not, a direct translation for every word that we want to talk about. So maybe advocating a bit more for translators and interpreters and not putting that pressure on yourself as a family member to be that person, to be trying to get everything right. So yeah, great. Beverly?
Yeah, a great point about the providers as well. Another thing, I'm starting to do some more research on it, is that the MOCA, the Montreal Cognitive Assessment that we do, is actually very Western specific and doesn't really capture adequately a really culturally diverse background of people. It really is a one-size-fits-all solution, which, as we know, is not effective. So what they're starting to see is the RUDIS scale is actually much better and a lot better for culturally diverse backgrounds. So as a provider, that could be something to get trained on, and providing both options to people and letting them see what's which one might fit better for you, for them to get a more accurate reading.
Awesome. Great points. I see Navjot has raised her hand. I also see that some of the attendees have raised their hands. So I will allow you to talk after Navjot has answered and Ron has answered a bit more on this question. Go ahead.
I think I just wanted to add to that. Often when we talk about especially diverse communities, we tend to focus on, well, these are the barriers they have. This is the issues they're facing. I think it's also important to harness the strengths they have as a community. And one of them is the collectivism that they have. So really pulling in those care partners, or if they don't identify as care partners, at least family members who are coming in and talking to them, because like I said, often in multicultural homes, they're 24/7, right? So they're able to provide a lot more information than the person might have been to provide themselves. And often being first generation or second generation, they do not have a language issue. Like I've done this. As far as I remember, I've been a translator for my parents and my grandparents, and I've been there and I've struggled. The smaller, sometimes my grandma describes how she's feeling in a certain way, and I really struggle to translate that in English, but really harnessing that power of that collectivism and pulling in the care partners, that family piece to get that history that you need to make that diagnosis also could be an important part.
Yeah, exactly. Perfectly said. Ron.
Okay, so I'm taking this to another way. And I'm in the technology space. So this is not for everybody, but we're getting to the stage now where we have apps that translate. Okay. The one that I'm a fan of that, well, you can't really see, it's a green one. It's Microsoft Translator, which is free. Just Google Microsoft Translator. I use it when I go to Quebec and I'm doing work with the Alzheimer Society, Montreal. Okay, I go there, I advise with them, but I don't know anything in French. So the whole time they're speaking in French and I'm getting it translated live, just like that. Okay, we're getting better at that. It's not for everybody, but if it's purely just about trying to kind of understand the essence of what they're saying, sometimes you could try getting a translating app. Okay, we're getting better at that all the time in the technology space moving forward.
Yeah, that's a great point. Using all of our resources, especially now with technology advancing, like taking those resources and trying it out. If it doesn't work, it doesn't work. And if it does, then it's great. So I see that Adelaida has their hand raised, so I'll let you talk and ask your question.
Hey, hi, good evening, everyone. You guys can hear me?
Yeah.
Okay, I'm so sorry for the voice. I got it from my daughter. Yeah. Um, I work in Singapore under Alzheimer's Disease Association. So basically, we do have a lot of different types of dementia. And I think it's good to know also here in Canada because not everyone are aware of dementia. So it's good to educate, I should say, the community regarding Alzheimer's dementia because not everyone are are educated with that, or I should say are aware on that. Because as my experience, I have a client 2 months ago. She passed away. She's a Parkinson's, and I can see I can see something that she's having a dementia, because usually if we admit a patient in Singapore, we have a dementia tools, whether I mean a dementia tools, if we can assess that client, that particular patient, I should say, whether they're having a mild, moderate, or severe dementia. So I think not everyone are like in a nursing home, I should say, or a long-term care, because the one that I work with is when I did ask the staff nurse whether this client is assessed by whoever is the doctor in charge regarding dementia, but then they said no, because uh the dementia, she's not having dementia. And as that's as what that's the answer for me. But I feel that starting of having dementia, I was rather already, if like kind of a Parkinson's, they already starting on that. Yeah, like awareness of the community, so that everyone understand, if the what I should say, if the mother or the father or whatever relatives they have, and they don't know what is dementia is, they're a little bit um uh how should say, like irritable. Yeah, they're very irritable with their family and so on and so forth. Yeah, I think we need to aware public or community regarding about dementia, more knowledge about them. Thank you.
Yeah, thank you for sharing that. And I think this might be like a good time for if the panelists have any resources that they want to quickly share about how we can kind of get dementia communicated to our communities. Yeah, feel free to kind of chime in and talk about some of those things, and then we can move on to, there's another question that we can answer, and then we can wrap up after that. Yep, go ahead, Ripley.
Yes, so I would say the Alzheimer's Society um, has initiatives where they have that's focused on dementia awareness and dementia friendly communities. We go out into the communities, we attend fairs and health fairs, and we set up booths, and we disseminate information on the disease and services. There's also information on our website. We have public education sessions that Daniel can speak to more more about that. So yes, the Alzheimer's Society is embarking on more wider information in the community, building dementia-friendly communities.
Amazing. Yeah. And as we mentioned before, we will also send out some resources in our follow-up email. Ron, if you want to, you have your hand raised, if you want to say something.
Sure, and I think also Navjot and Danielle has it as well.
Oh, yeah.
I'm gonna just throw out because Ripley, we have the Alzheimer's Society here. We love that they're out there trying to educate. Yeah? And Adelaida, you're correct. It's about awareness. The challenge is that we don't have enough human resources to go out and educate, and Alzheimer's Society can only go so far, which is why it's important that we have to feel comfortable to share our stories within our communities. Okay, so my mom every Saturday she goes to her Filipino dance class. All 100 ladies, all 5'1" Filipino ladies doing their line dancing and whatever, and their chair yoga. And that's the opportunities where she's had people come up to her and say, "I heard your husband had dementia," or and that's where it starts. And my mom's comfortable talking about it, right? So if you've gone through it, everyone here, I'm suggesting whenever you're in that space, possibly, okay, the holidays are coming up, okay, not to just go out and start talking about it, but you might see that family member or someone else in your circle and just saying, how's your husband, and if they're willing to kind of talk a little bit about it, you say, yeah, we kind of went through something similar, and you're just telling your story. That alone is the win. And then eventually as they get more educated and more aware, they're not going to be as irritated because they could see it from someone within their community, and then eventually make it to the Alzheimer's Society, hopefully. But not always, it can't always come from the Alzheimer's Society or Dr. Jenny Rabin, or Harleen. This has to also come from us being comfortable to just kind of plant those little seeds. So I just wanted to share that's another way to do it.
Thank you for mentioning that. Navjot?
Yes, no, Ron, excellent point. I just wanted to build off of that and talk about a few resources. So when we speak up, when we go out and share our stories, and alongside of that, also participate in co-design teams, right? Participate in research so our stories are out there to people who are then able to move it down and bring that policy change in place, right? So there are resources that are now coming up. So there's the Forward with Dementia initiative. And I think Ron, we were part of that with the UW and Schlegel. So they have this website where the resources are not just translated, they are adapted where they took the English version to the community and said, people who were experienced in terms of living with dementia, care partners, and researchers, and said, this is what we have. How do you think we can make this better? So they're not just translated, but they have pictures that are representative of the community. The message that they're trying to get across is culturally appropriate. And as Danielle said, sometimes the word for dementia is very stigmatizing. So making sure that how they portray that word, there's Forward Dementia, then there is the Forward Dementia for now is with South Asian, Italian, and Chinese community. They are in works of further developing it in more languages. There's another one called Memories and Harmony by Indus Community Services. So it's tailored for South Asian community, but it's available in about 8 different South Asian languages. And it goes through what is dementia, how to take care of yourself as a care partner. It talks about stigma extensively of different types of stigmas that you experience for someone living with dementia. And then there's also another one by McGill University, and it's available in multiple languages. It's called my Dementia Companion Guide. And if you reach out to your Alzheimer's societies locally, they'll have access and provide all of these resources to you. And lastly, I think as we talk more about this diversity piece, a lot of researchers are now focusing on, well, we haven't really looked at this in such and such communities. So with keeping that in mind, how do you engage with communities without causing harm? Because we have seen instances where researchers have gone in and caused more harm, and we have it in our history, the studies that happened in the past. So keeping that in mind, the Research Institute for Aging also came up with a guidebook for researchers on how to do safe and inclusive research for people living with dementia who are part of ethno-racial communities. So that's another excellent resource for researchers and healthcare providers to kind of look in and reflect on their own biases, their privileges when they are interacting with people from diverse communities.
Great, thank you, Navjot. Danielle, anything else you'd like to add?
Yeah, I was just gonna say, if we go more outside of regional, globally, there's a lot out there on dementia, and there's a lot of good resources of really great tools and things that have been created worldwide that are culturally sensitive and in other languages. And so, I mean, we can certainly share and when you send out an email, we can certainly provide links and things to that. I also think sometimes who's providing messages, and to Ron's point, coming directly from lived experience is always great, and it really does help break down stigma. But I did have one client once who he was referred to us because his wife had Alzheimer's disease, and his cultural worldview was that she was possessed. And I knew that anything I said or anything I tried to help with would not be helpful because totally different worldviews, right? So the first question I asked was, who's your community? Who's your spiritual leader? Who, right? And can we involve that person in? And because sometimes you're not the voice needed, right? Even though you may be the expert in dementia care, you are not the voice needed, right? And so I think we have to kind of get over ourselves a little bit and bring in as many partnerships and as many like think of a wider team, like who can we bring in? Because I really think that will help too, um, to overcome some of the cultural barriers that may exist.
Yeah, you brought up a great point. Just the idea of like engaging in collaboration and really understanding your patient or your client and knowing what is their worldview and how you can integrate that into intervention and treatment and just care in general. That was a great point. There are some comments in the chat, but I know Parul has their hand up, so I'll let them ask their question. And then hopefully we can get into the comments in the chat. Whenever you're ready, Pearl, you can just unmute and ask.
Hello, can you hear me?
Yeah.
Yes. Okay. So, from my experience, what I want to bring out is I'm coming from the South Asian family as well, and lots of interpersonal relationship issues arose among our siblings, the three of us, and our spouses. So I'm in healthcare. I already knew about dementia a little bit. I saw the signs of dementia in my parents. A little later, 3 years down the road, they were officially diagnosed by geriatrician as having dementia, both of them at the same time. The journey, the symptoms came very slowly, and it came as worsening of their personality and other things which were already there from decades, and it just got worsened. But the way it progressed, and I tried to deal it my way, and I kind of tried to communicate those things to my siblings, my brother and sisters, my spouse and their spouses, and all of us kind of took it in such a way that I was trying to make it all for myself and all other different layers. And our relationship started going downhill, which was very good at one point of a time, I perceived. And it started going downhill. And we were so much distracted, each one of us, that our parents' care, I saw that that is one issue, and we are dealing with the other issues. So, and I had to go and have the counseling services for myself, because as Ron correctly said, I was going so much downhill. I needed to make sure that I am on my feet, emotionally healthy to look after them. So I also kind of thinking about what Ron was saying, do what is right. Now I knew what is right. I was not thinking about myself, but I could not do what was right for my parents because of the relationship issues that our family felt. So I was kind of looking for some resources, if I could, to I don't know how to resolve this, and this is it still going on. Both of my parents are still alive, and we are divided between two countries. Two of us are in Canada. One of us is there in India, and we don't know what to do. I don't know how long it is going to go. I don't have their responsibility at this time, but I see myself, I'm suffering day in and day out without having to do anything for them at this point. So I want to bring myself out of this agony. Also, I want to do what is right for my parents, and how do I do with it?
Yeah, Ron, you can go ahead.
Yeah. So thank you, Pearl, for sharing there. That's the story that the Alzheimer's societies get all the time. I know they hear these stories. And so just to clarify, for me, it's actually not about doing what's right. It's doing what is best. And I'm going to try and quickly answer one of the questions in here. That the question was from Shivani with regards to feelings of guilt. Okay, I'm going to sneak that in here if I can do it in 1 minute. It's Ron's view, doesn't mean you have to agree with it. Okay, but for me, it has worked for many people that try it out for 2 or 3 weeks. Okay, this comes back to the language. Okay, to me, it's not about right or wrong. A lot of our cultures is very spiritual. It's like Catholic, heaven or hell, good or bad, sin or you don't sin. Okay, so that's one of the things. And it's one where we have to be very careful on the language that we use in all of this, okay, about right or wrong. The guilt piece. Guilt is really on each of us, our self-judgment. Okay, it's a self-call. Did I do something bad or wrong? And if I did, then I'm going to feel guilty about that. And based on our cultural values, there's a lot of guilt that comes into it. So what I try to suggest to people is to say, change your language. It's all about the words and how you talk to yourself. Okay. And part of that is, am I doing this right? Because if you're not doing it right, you're doing it wrong. That's the only way. Versus, am I doing what's best? And it's not going to be perfect. And it's not going to make everyone happy. Okay. But is this the best move at this moment of time? Even though it's not happy, even it's not going to give you everything you want, is this the best move versus is this the right move? Okay. And you may not get it perfectly, but it's less stressful with the words that you use. So I will always say, play with the words, try removing right and wrong out of your language, good or bad, and try just saying, is this the best that I could do right now at this moment of time, with the resources and the people that I know. Be careful in the future, judging yourself when you know more information and you judge yourself back in the past saying, I should have done this. If you didn't know that back then. Okay, so be careful of that piece as well, going backwards and judging yourself. So guilt is a lot about self-judgment. And why I tell people caregiving shouldn't be about guilt, it's because you all care. Everybody here cares. Okay, so why should we punish ourselves? Because we care, but we're going to screw up. We're going to make mistakes. It's not going to be perfect. People are not going to be there to support us sometimes. So we try to do what's best. Okay, but it's not going to be perfect. And that's what dementia is about. So that's just my comments back.
Yeah, thank you for that, Ron. Just to be mindful of time, before I get to Navjot, I know there's a question that also kind of fits in with what Parul was talking about in terms of guilt, but I thought maybe Navjot, you'd have a bit more of a perspective of younger caregivers and dealing with, the guilt while balancing school and acknowledging the need to build their own life. If you could also speak to that, in addition to what you're going to say, that'd be great.
Yeah, I was just gonna touch on Pearl's point, but I'll come to Shivani's. I think I can just validate that those feelings are real. Honestly, I haven't figured it out. I still struggled. I've moved across the country, so now the guilt for me is 10 times more. I'm no longer able to just walk in and relieve my mom. I hear her on the phone, and I think there's only so much so I can say verbally on the phone to her. So I haven't figured it out. I feel guilty, but I guess to what Ron said, we care, right? And I wish I had an answer for you, but I'm just saying those feelings are real. I don't know what's the right way to balance it. I'm in school. I'm there, like, my parents have a language issue, so I have to help them. And the other thing is every time I visit them, I see them now visibly getting older. So now it's just not then and the guilt just hits 10 times harder because now I'm watching them age from afar. So I'm sorry, I don't have any like answer
I
for
was going to
that.
jump in to answer Shivani as well. So when my dad was first diagnosed at the age of 62, my parents were not together. I had a 6-year-old and a 9-year-old, and I worked full time, and I was the primary caregiver. So I was in that sandwich generation, and I was panicked. I was like, okay. And one of the things that someone suggested to me, and it was another family caregiver, was to write out, realistic expectations, like of myself, but also of what my dad's needs were going to be futuristically. And it did help me to realize, because I was debating whether I just move him in with me and I just provide his care. But I was off to baseball tournaments in the United States for my son's baseball. Like I was like, who's going to be home? Like, right? And how does this affect my 6-year-old and my 9-year-old? Right? I had to look at everything. That did help, because I was just so like focused on, I'm just going to do it. And luckily someone said, I think you need to really think about that. Um, I'm not going to say it relieved the guilt. It didn't. The guilt was, I mean, the day that he went into long-term care, like it was the hardest day of my life. But I also knew I couldn't give him the 24-hour supervision he deserved, and for his safety and his well-being. So I don't know that we get rid of guilt, but there, to Ron's point, we can self-talk about to ourselves, and we can be fair to ourselves.
So very quickly, Daniel, that comment, I just got to throw it out, is a great example of you did what was best for you. It's not perfect, okay? But if you now start saying, did I do what's right or wrong? If those are your words, guilt is going to come in. But did you do what was best, right? And that's what I'm just saying. If you try just shifting the words around, okay, it's still the same story, but it's how you will take it on. It's very different. That was the best you could do in that situation, that time, versus did you do what was right or wrong? It's not, it's just right or wrong. So that's how I would tell people. So
Yeah, I actually quickly wanted to come back to Parl's point about the family dynamics and the relationships around. I think that's one of the, I don't want to call it downside, but it's like being that collective, like everybody's involved, because I've seen it with my family where everyone wants to give their advice. They feel that what they're saying is the best. And then there's also this thing in some communities where even though women are doing the caregiving, they're not the decision makers. It's the men who are making the decisions, which is kind of like, well, they're giving care, they should know, but they don't have a say in when it comes to the decision making. And I think Danielle and Beverly, correct me if I think there is almost like a workshop or a resource where the family can come in together and learn about dementia as a family rather than giving resources to individual. Because I've heard from some care partners, especially from South Asian communities, that that really actually worked for them when they were able to get their siblings and everybody on one table and talk it through with people from the society. It really helped kind of set those of what is dementia, because everybody was on a different page. People who weren't living nearby kind of didn't understand what it was, and that was really helpful for them. So I'll give it to Danielle and Beverly because I personally don't know a lot about it. I've just heard about it from care partners.
I can give it to Danielle because she facilitates this education actually, but it's called First Steps. And yeah, it's anytime I hear that, I think First Steps is usually the best option. But yeah, Danielle, it's your education. So if you want to.
Yeah, it's for the person living with dementia, and any family partners they want to involve. So sometimes they bring in siblings, sometimes it's adult children, sometimes it's spouses, sometimes it's a spouse and an adult child. Anything that the person living with dementia is comfortable with and wants. But yeah, I do find that the learning together is great, and it does keep people a little more on the same page, and they're hearing the same thing. I wish I could say it's offered in all kinds of different languages. It's not, obviously, but yeah, if the language used is pretty, it's not too technical. We try not to make that medical language, so it is meant for lay people. So the language, as long as there isn't, there's some proficiency, it's doable.
Great. Thank you, everyone, for sharing those resources and, really talking to Pearl's question of the collectivist aspect of, some cultures where everyone's involved. So thank you for speaking to that. And also Danielle and Ron for really talking about those actionable things that people might be able to do to help with the guilt. So writing down clear expectations, trying to reframe their perspective of things can be helpful. And I know there's a question in the chat talking about resources, but as we've mentioned before, we will kind of put together all the resources that are available and that the panelists think will be helpful, and we'll send out in an email. And I also just wanted to quickly address one comment by Sama talking about really taking advantage of the Canadian medical interpreters and using them to help navigate your family members through the medical system. And I just wanted to kind of reiterate that, there are interpreters out there to help us in these situations. And again, take that pressure off yourself as family members to be that sole translator, trying to kind of, communicate with healthcare providers. Okay. Okay. So I think that is it. So thank you to all of the panelists for taking the time out to really share their stories and talk about resources and connect with the community here today. And I'll pass it to Jenny to say anything else.
Yeah, I just wanted to reiterate what Harleen already said, to thank our panelists for a very, very informative webinar. Thanks to the audience for your amazing questions and interest. We will follow up with resources in an email, and we hope to host future helpful webinars in the future on various topics. If you have any suggestions for future topics, please send an email to Cortex Conversations. That email address will be included in the follow-up email. And we're also open to any feedback and suggestions you have on this webinar. We're really here for you and to provide information to the public. So please let us know how we can best help you. Thanks everyone again for your time. All the best. Good night.